Hello, everyone. Welcome to the Essential Wellness Empowered Health Educational Series. My name is Aisha Harley, and it is a pleasure to be with all of you today. Thank you for joining us live, and/or hello to you if you're watching the recording later. You guys are in for a super treat. We have two amazing ladies with us today. They are both a incredible wealth of information and have years of experience and so much goodness to share. We had this presentation live in Portland on Monday, and it was awesome. Everybody loved it. As we go through the presentation, if you have questions, please just type them into the chat box, and hopefully we'll have time at the end to answer them. And Jodee, would you go ahead and go to the next slide, please? And I'm going to just get right to it and give them their introduction so they can share what they have with you. So we have Dr. Jodee M. Anderson and Dr. Elizabeth Mcelligott. Dr. Jodee is a Stanford graduate medical doctor. With 20 years she spent running the OHSU NICU unit. So she is quite an accomplished professional doctor, and again, just really has done amazing work. And 4 years ago, she decided to change the direction of her career, and she studied aesthetic medicine, and then she opened up a spa in Northwest Portland, a skincare spa. And what I love about what she does is she combines the best of both worlds. She offers the best of non-surgical skincare treatments, along with a holistic and natural approach, and really educating women how to take care of themselves from the inside out to really tap into their natural beauty and their health. And then again, using all of the array of products she has to help enhance that. And so she is going to, again, share her awesome knowledge from her experience in the clinic and all that she knows with us. And then she is accompanied by Dr. Elizabeth Mcelligott, who is also comes from a very extensive background. She is a graduate of NCNM here in Portland, Oregon, and she has been practicing for 10 years, also with a focus and expertise in both skincare and women's health. So as you can see, we are in the best of hands with these two, and I am so grateful for your time today. So I'm going to pass the presentation right on over to you. Thanks so much, ladies.
Great, thank you. Introduction, Aisha. Welcome. At Fresh Faces, when I started this, I thought it would be really nice to go from being in a very, very intense critical care environment with real children to talking with women about things that they were struggling with and seeing what I could do to help them feel better about themselves. And I thought that was going to be more simple than it has been. In West, I just kind of trained to think about putting Band-Aids on problems. And I definitely approached some of this that way when I started. So people would come in, they would have concern about the way they were aging, their face. And if it was a wrinkle here or a frowny face, we could do some Botox, and that would last for 3 months. And I thought that was great. Be back 3 months later, and they kind of feel the same way about them. And then again, 3 months later. And it occurred to me over time that there are some great things we can do to temporarily change the way we look. But so much of how our skin presents on the inside. So this presentation would be incomplete if we didn't start with a place that Elizabeth and I definitely know on, and that's about your self-care. And when I look at the doTERRA pyramid, I see this as a way to avoid having to go to medical care, a way to avoid having to get a doctor to help you. There are so many things you can really good care of yourself. With your skin as your large organ, it's the first where your true health is going to present. So Elizabeth and I like to talk about, and I've learned a lot more in terms of a healthy approach to lifestyle. And I'm going to let her talk a little bit about what it means to eat right and what that means for your skin.
Yeah, so skin one of the windows into someone's health, right? Someone and they have got skin and you're like, oh, that person's got great skin. That's so bright and exciting. And then you see a person who's struggling with acne or psoriasis or these stubborn skin diseases, and these are just inflammatory conditions, and it's really a sign that things just aren't right inside. And eating right, as you can see, it's the foundation of pyramid. It's basically the one thing that you have complete and total control over. So eating great food, eating fresh fruits, vegetables, trying to avoid processed foods. The standard American diet is just so filled with processed foods. Everything has bleach, flour, sugar, partially hydrogenated oils. And we're really seeing the impacts of these types of additives in our foods currently. It's kind of taken a while for our society, over years and years of eating these foods, but currently we just have the highest rates of diabetes, cardiovascular diseases that we've ever seen before. So there's a lot of different types of diets out there, and that will be a webinar at some point. But there's paleo diets, and we've got vegan diets and intermittent fasting. It's really difficult to decide what's right for you without going to see like a nutritionist or a naturopath or an MD that specializes in functional medicine to kind of figure that out for you personally. In general, you're trying to shop at the outsides of the aisle, trying to stick with the produce, the meats, and really trying to just avoid all those middle aisles with everything that is convenient in a package. It's going to be your best bet. The body is in first process of disease, so reducing inflammation is going to be the best thing that we can do. And the way that we can do that is by eating, well-sourced foods, things that are free of hormone, grown locally, and lots of fruits and vegetables, and a plant-based diet.
I think that I love the theme, kind of look where the sources of inflammation come in when we're thinking about our health and then our skin. So I'm just briefly going to say, in terms of exercise, we can really overdo any of these things. And this is about your body and moving your body in a way that's so you're not overdoing it, necessary inflammation, but you're doing it. So you're also not sedentary. So that means 10,000 steps a day, or it's a full trip to the gym. It has to for your body without stressing it. You worry a lot about rest and managing stress. When I think about sleep, I think about how little education I got on sleep. And they probably did that for a reason, because now, the hard way, come to understand the impact that sleep deprivation has on us. And you don't have to be an ICU doctor to experience that. Just ask yourself, are you getting more than 7 hours of sleep a night, every night? And if you're not, it's impacting your entire body. It's increasing your inflammation. How that manifests in your skin. They say that you get less 7 hours of sleep and you have twice as many wrinkles as somebody who gets more than 7 hours of sleep a night. So if you don't care about the rest of the health benefits, it's definitely causing you to age. And there are some simple reasons for that. So when we sleep, our body goes into a rest and repair stage. The science of sleep is still something we're trying to understand, but we know that much. We know that we release growth hormone when we go to sleep. Growth hormone is responsible for cellular and tissue repair. It also helps with collagen production. So just to back up a minute, there are 4 types of collagen in your skin, and they are responsible for the structure of your skin. So deep down in the surface, as we age, we produce less and less collagen. Many of the treatments that we use in the office are designed to injure the cell so that you get good collagen remodeling. You need growth hormone to happen. So if you're not sleeping, you're not secreting growth hormone, you're not getting that cellular repair. So you start to not only produce less collagen, you can't repair it's already there. And there are a number of things that degrade your collagen, inflammation being a primary source of degradation. So do things like in the, our anything generating free radicals, our diet, all of those are attacking your collagen. One of the worst attacks on collagen comes from cortisol. We all hear about cortisol as a stress hormone secreted by the, but when you're not sleeping, you actually get elevated levels of, naturally when you fall asleep, it's supposed to kind of decrease as we fall asleep. And then you get a little surge around 4 a.m. If you're in sleep, it never goes down. It really translates to you're in constant fight or flight when you're not sleeping. So your body's not really worried about repairing itself or maintaining any sort of semblance of, it's worth fighting with tiger that's keeping you awake. And that's not going to result in good health. And what we know about collagen is that's triggering a lot of inflammatory changes. And inflammation breaks down proteins, and again, the skin being a representation of the health of the rest of your body. So getting good rest and managing your stress are really critical in this to the way that your skin presents. We kind of move into toxic food, which ties a little bit back to eating right and some of the things that Elizabeth talked about. But the things we're exposed from laundry detergents, dryer sheets, hormones of food, all of those are having an impact on your inflammation. We just all pull it back down to inflammation, but your inflammatory levels. And those are going to impact your health and your skin in a number of ways. So just addressing eating right, exercising, sleeping well, stress, and thinking about your toxic exposure, you do a lot to avoid. I don't need to see Elizabeth and I. So these are lifestyle healthcare needs. I always think that at this level, self-care is healthcare. It's just about taking really good care of yourself. So to talk about the pyramid, we all have to bring in the Lifelong Vitality Pack, another place that Elizabeth and I definitely see eye to eye. This is organized in a way that I talk about it. Elizabeth, please pipe in at any point. When we start with antioxidants, this is such a term that you see it in the literature, you see it popularized, you see it on TV. What is for your skin? What are antioxidants doing? If you think about these insults that we experience from pollution to sun damage to cigarette smoke, all of these things are damaging your DNA and they are free radicals. Well, antioxidants are free radicals, so they protect your DNA. Your skin cells turn over pretty rapidly. If you have damaged DNA, which is the blueprint to cellular, you won't get the normal production of skin cells. So you need the antioxidants to turn over in a healthy way. They help a lot with inflammation. And I talked about, and so did Elizabeth, inflammation being a source of skin problem and the lack of skin. Antioxidants help with skin firming. They can reverse the effect of aging through some of these rejuvenating and firm effects. We see especially with vitamin C and vitamin E, which I'll talk more about, but those are considered antioxidants, as are other things that are found at the alpha CRS. Something I find really exciting about alpha CRS is that with it, you get an improvement in blood flow to the skin. So if you have scar formation anywhere on your skin, from acne scars to maybe a really old cut, just increase inflammation to that area, help with the production of new collagen and the decrease in the appearance of that inflammation. In terms of omega fatty acids, for long, the diet and said to avoid fat, and what a disservice they did to us. We started eating really high sugar foods to avoid all these fats, and these fats are so critical. In the Western diet, we get way more of the omegas we don't need than the omegas we do need, and I can't keep track of all the 3s, the 6s, the 9s, but thank God that I've got these omega fatty acids I can take that will help balance out the omega 3s and omega 6s and help to balance out some diet choices. The acids are really what's protecting your skin. They help to smooth the skin surface. They increase hydration, decrease inflammation. And remember, 4 of your essential vitamins are fat-based vitamins. So those are A, D, E, and K. K is critical. If you've dark circles in your eyes, vitamin K can help. Stretch marks, vitamin K can help. Spider veins, vitamin K can help. And you get adequate amounts in the E omega. I know Elizabeth talks a lot about how critical vitamin D is in all of your body, including your skin, and I'll let her talk a little bit more about both the fact that adequate levels in the Lifelong Vitality Pack. Also, what happens to us here in the Northwest in terms of vitamin D.
Yeah, so vitamin D is critical for men and women's health, especially for women's health, because it's a major player in our bone remodeling. So a lot of with a condition called osteoporosis osteoporosis, but before osteoporosis, there's something called osteopenia, which is basically bone loss before you actually have the disease. So vitamin D is critical. There's definitely that have shown increasing vitamin D levels can actually stop osteoporosis in its tracks and actually reverse it. So that's very, very, very important for women. The other thing about vitamin D is it's essential for your immune function. And vitamin D is actually a hormone. So it's a hormone pathway that's critical for your immune system function properly. People who live in the Pacific Northwest, and we really only get about 6 to 8 weeks of direct sunlight out of the entire year. So across the board, vitamin deficient. We commonly see vitamin D levels down in the 9s, 10s, and 11, and they really should be up in the 60s and the 70s for proper immune function. So vitamin D is really, really, really important, and there is active vitamin D in the microplex, and then you also get vitamin D in the omega-3s. And along with what Jodee was saying with how important the lung vitality pack is, I get a lot of questions about, if I eat right, should I have to take vitamins? And the reality of it is that our soil currently is 40% packed with minerals and vitamins that it would be. So, and that's just because of agricultural farming and erosion. And so it's just kind of where we are with the commercial food industry in the United States right now. So Jodee made a really great analogy about the orange, which I'll let her share. But yeah, we're just not getting the amount of nutrients out of our food anymore.
That's fascinating. So we all know vitamin C, that's your citrus fruits. It's really high in kiwi. It's everywhere. It's amazing to me that 20% of 25 to 40 deficient in vitamin C. And why that might be thinking about skin is vitamin C is it's a pro-collagen vitamin, meaning you can't make collagen without it. So not are you starting to break that and not make as much collagen as you get older. You have all these injurious things that are decreasing your collagen. We're vitamin deplete, so we're not getting enough of the vitamin C to produce collagen. My grandmother was almost 100, and when she was a kid and she ate an orange, they say it was 8 times more than an orange that I could find in the groceries today. It's probably why she had perfect skin until she was 102. But it's sad what's happening from farming practices and other things, what's happening to our fruits and vegetables. So even if you are somebody who can find 12 servings of fruits and vegetables a day, it's no guarantee that you're going to get what you need. So I'm a huge proponent of the Lifelong Vitality Pack for a number of reasons. We talked about this at the live talk on Monday. This is just a way to analyze skin. There's a lot of skin analyzers out there. This one's called the Vizia. And I just want you to think, without having anybody like an expert analyze your skin, if someone said to you, what's bothering you about your skin? Could you define it? Do you have words for it? Do you understand it? Reason to have a shared vocabulary around this is so that we can help you to achieve the goals you have for your skin. So we just go across this picture. The first picture just depicts kind of the texture, the overall gross kind of texture of the skin. The second picture is looking at little lines and wrinkles. The third picture is a detailed description of the texture of the skin. The fourth picture looks at your pores, pore size, increasing pore size over time. This fifth picture is looking at UV damage. Even when we're not seeing outward brown spots on our skin, the UV damage we see as children is impressive. And we can see from this especially when you look at sort of the top there, she doesn't have that many brown spots presenting there. But over time, this is where we can predict that her melanocytes will sort of up and start producing more pigmentation. The sixth picture is looking at the brown spots we can actually see in the skin. The seventh picture is looking at inflammation in the skin. I love this one because it's not something when you look in the mirror and you're like, gosh, my nose are red, or I get really red around the neck, or when I wasabi, I just flare up through here. That's actually a sign of increased inflammation in your system, and potentially, which I would talk more about. And the last picture is looking at the bacteria in your skin, which if you're somebody who's prone to blemishes and breakouts, knowing what your bacterial load is can help which product is going to be most helpful to you. So we sell things that are grade. They're pretty harsh. I think if people understood a little bit about which aspects of their skin they were most concerned about, what they were trying to address, it would empower them to pick products that were tailored to what their goals were. So even if you can't describe your skin in this allows you to start thinking, pore size really to me, and I break out a lot. You pick two things, and then in the next slides, we're going to go through these beauty swaps where we talk about pharmaceutical grade, but some of the essential oil comparison. So how you might be able to swap out, use essential oils to address your specific skin needs. So there's philosophy, and it's confusing. I get kind of annoyed or pissed off when I look at beauty industry does to us because, Elizabeth and I combined have way too many years of education, and it's still right? Like, you go in and you try to find the right stuff for your skin. It's not easy to pick out what it is you might need, and you get all of this false advertising. The majority of things sold at Sephora are not going to have to be approved by the DEA or the FDA, or nobody's keeping an eye on whether or not being told. So understanding how to describe your skin, what bothers you, and then adopting a philosophy around skin. Be the perfect philosophy for everyone. I think a lot about anti-aging, and the philosophy that I subscribe to is about that. But if you've got specific skin conditions and want a little bit more talking about those, we're happy to help you. Our skin consults are free. We've got a lot of experts at this. But in general, don't put your skin to sleep. You want to challenge your skin. I don't know if anybody even can remember who he is, but Christy Brinkley screwed the heck out of her skin, got pretty good looking skin. I don't know at all. Surgeries and treatments and injections she's had. But this idea is, as we have less hyaluronic acid, and therefore our skin has a lot of dead skin cells on it. It starts to lose its volume, it wrinkles hair, and it loses its hydration. So the things that we do, there are some things you do to look better in the moment, and then there are some things you do so your skin ages better. And when we say ages, I want skin cells to turn over more quickly. I want it to hang on to water so that I'm more well hydrated. And I want to get rid of that. I want to kind of help accelerate sort of the process so that my skin's behaving like it did when I was 25, and I'm 95. So whatever I've been doing for the last 70 years, definitely working. I'm kind of kidding. All right, so we're going to talk about exfoliation, blood regulation, hydration, and how to get after those things with essential oils. This speaks to this community because from what I've learned as a part of this community is there's an opportunity to reduce the load. And I believe in these pharmaceutical grade products. I do believe about their long-term impact on your liver health and your toxic load. Elizabeth, before I switch to the next slide, is there anything on this I wanted to say?
Yeah, you really explained it well, Jodee. I mean, when you're trying to take care of your skin and you're starting to age and you don't know what to do, and so many places you can go. You can go to the health food store, and everybody just has, an idea about how you're supposed to take care of your skin. And the reality of it that it's true. Don't put your skin to sleep. You exfoliate it. Right? You want to keep it alive and hydrated, and you want constant cell turnover. Same philosophy to our skin as we do our body. We don't put our bodies to sleep. We have to exercise. We have to eat. We have to take care of it, and then we have to rest it. So it's the same thing for skin.
This is one of my favorite places to talk about Reveal, the Reveal system. It was one of the first skincare products I used from doTERRA. It's one of my favorites. I like that scrub, and I like it as well. But the Reveal system has orange and lime and pumpkin. The pumpkin enzyme is giving you a chemical exfoliation through some of the acids, and it also has a little bit of it. They're actually jojoba bean, which are safe for the environment, but those are creating that mechanical exfoliation. So you're getting in one, well, it's a different, but in two, you're getting a great exfoliation, ionizing of the skin, but is hydrating you. And orange has enough vitamin C that you're probably getting a little bit of stimulation, collagen, be producing a bit of a brightening effect. If you guys, which I am, and you want a quick step, this is something that I keep in the shower, and definitely, I think you could work your way up to using that almost every day. So the king of all oils, we have to start with frankincense. But to understand frankincense is really great for your skin, I think a good place to start is why retinol. So you've heard of retinol and you've heard of retin-A. Retinol is the alcohol form and retin-A is the acid form. There are prescribed grades, and there are over-the-counter grades. Retinol, though, is really helpful. It's a derivative of vitamin A, and it's used to help your skin cells. When you're 20, you might not have a lot of retinol, but when you're 35 or older, your skin cells are slowing down, and retinol can really help to increase that cellular turnover. In doing so, it can shrink the size of pores. It does help with acne breakouts. You'll hear people being grade retin-A for acne. But all of it comes down to turning those skin cells over. I'll talk more about acne, but one of the reasons acne is that if there are 4 components to acne, clogged pores are one of those, and from the skin cells. So getting that turnover is important. But retinol and retin-A can be really harsh on the skin. You read on this, and it can be pretty sensitizing. If I use 1% retin-A for 3 days, I'll end up with peeling skin, which is great theoretically. My skin's really tired, but I feel really crusty when I go out in public. So one of the things I love the way that you can frankincense instead. Frankincense rapidly increases cellular turnover. You hear about people using it on scars. One of my good friends loves to tell me that she does frankincense on side for 3 days. She can tell a difference between the 2 sides of her face. I haven't tried that experiment, but I totally believe her. It's great for all types. It's got antibacterial and anti-inflammatory activity. I don't know about you guys, but when I'm not sure what to treat a problem with, I know I can just say frankincense. And the same thing applies to your skin. This is a great first step go-to. I keep the rollerball in my purse. It can be a great toner. It can help with pore size. It's a really nice comparator to retinol without all of those side effects, all of those great benefits. And I guess I feel like that about a lot of the doTERRA products. It's kind of like I know I'm not causing more harm to my body, but I'm also getting a little bit of a benefit. I'm getting the benefit of sense that I'll be absorbing. I'll get all of those great brain effects and anti-inflammatory and mood effects as well. Elizabeth has such a different kind of take on a lot of these. I want to each time and make sure I'm capturing your thoughts on these things too.
Frankincense, topically on the skin is incredible. And again, it does have, all the things you were mentioning, but also, traditional medicine perspective, use it for a lot of chronic illnesses like Lyme and to decrease your viral load. So people take frankincense internally because it's the best oil. We grab it for almost anything, but its immune modulating properties are fantastic too. It's used for scents by a wide array of cultures. So it's pretty fantastic that doTERRA has managed to bring it to us in a sustainable way because it can really far plays. So
it's awesome. So lemon oil for salicylic acid. The first question I have is, why would I put salicylic acid on my face? Salicylic acid you're going to find that a lot in acne scrubs and in some anti-aging products. It's a type of beta hydroxy acid. We talk about alpha hydroxys and beta hydroxy acids, and it can help to treat acne, exfoliating the skin and dislodging dead skin cells from the pores. It comes in concentrations. It can sometimes reduce a little bit of redness in the skin as well. It's sensitizing though. So some people can't tolerate it, and in too high of doses, you get salicylate. I haven't actually seen them from over the counter salicylic acid, but it's not without its components. Our swap for that is lemon oil. Lemon oil, I love lemon oil for a number of reasons. On this particular slide, what I'm trying to point out is that an oil can work an acid on your face. Now that means I'm talking about chemical exfoliation again, and about like, hydrochloric acid on your face, just a little bit, so that it's a complete challenge, so that you're clearing out those dead skin cells. So whether you're dealing with an aging process where you're knocking the skin cells over as quickly, or you've got some clogged cells in your pores, lemon oil can really help. I put on here that it helps with hyperpigmentation. We're going to talk more about that, but specifically for the replacement of salicylic acid, lemon oil can be helpful. I do say though, this is photosensitizing. You don't want to put this on in the morning and then go out in the sunlight. Benzoyl peroxide. This is another one I got hanging out on the Walgreens aisle. You guys might not shop there. But benzoyl peroxide is another really popular acne treatment. You'll always see these in, and it's effective. It's effective for a number of reasons. It's a non-prescription drug that can destroy causing bacteria. Used to be known as propionic bacteria. It has a Colchi bacteria is the name of it. Nonetheless, it works to destroy that bacteria, and that's one of the other components of acne. So in that last picture of the Visia that I showed, it showing those porphyrins, that's a sort of shows you what your distribution of acne is like. I'm always surprised if I do that Visia in the morning versus the end of the day. By the end of the day, I have cell phones and hands and the back of my hand, food, everything on my face. I have more bacteria on my face than I realized. So benzoyl peroxide is used by people that want to decrease that bacterial load. It says at the base here, it can really dry out your skin. And we used to take that approach to acne, which was just starve it, dry it out. And your skin can start to peel from the effects of that. So we have a nice swap for this. I have to laugh because I've tried all these things and I've made some good mistakes that I don't want anyone else to make. I had a nice North Star blush on my chin about 6 months ago, and I wanted to see what would happen if I put clove oil on it. But I'm also kind of I want instant results person. I couldn't even wait overnight, so I put a lot of drops of clove oil on my chin, and it totally took away that pimple. It also took off a layer of my skin. I've healed fine, but it's almost a chemical peel on the face. Me, clove has got a huge antioxidant load to it. It was able to decrease the inflammation and really clear up that bit of acne. And I know Aisha has talked about this. But clove can be used in small doses directly to blemishes, cystic acne, as you're trying to get rid of it. You don't need to reapply it 45 times before you go to sleep. You could end up with. And then, of course, Mcelligott, both known for soothing, but also it's antimicrobial, antifungal, antiviral. This can be great for decreasing bacteria without causing any kind of resistance. And because this month we get with Manuka and Litsea, I like to talk about those a little bit. I did open up my Manuka when it came, and they told me it was going to smell like honey. It did smell pretty earthy to me, but that can be used in place of Mcelligott for the anti-inflammatory, soothing, and then the anti-microbial effect it can have on your face. Elizabeth, do you have any other thoughts about Mcelligott, clove, or Manuka oil here?
I think combination of clove and Mcelligott together they're pretty incredible. Both steam distilled, and as Jodee said, they have antiviral, antimicrobial, antiparasitic, antibacterial. So whatever the cause of your acne is, or whether or not you're just trying to clean your skin after the day, I think that the combination of both of these are really powerful. They just sort of they include every single possibility.
I think that's probably a place to back up for, because I say acne is much more simple than we realize, and it's not just happening to teenagers. A lot of us get it, sort of a hormonally based acne around our chin. But generally, it's because of clogged pores, excess oil production, bacteria, inflammation, and then a hormonal or medication or some sort of toxic exposure type issue. But those first four are things that you can quickly do things about. Rose oil. So you'll see hyaluronic acid, and this is different than the other acids. I've talked about alpha hydroxy acid, beta hydroxy acid. Those acids are used to kind of as a mild exfoliation for your skin. Hyaluronic acid is very different. Hyaluronic acid is extremely hydrating. It's moisture binding. It can carry up to 1,000 times its weight in water. So you're getting it put in beauty products like crazy, and as we age, we naturally produce hyaluronic acid, but as we age, we produce less and less. So it's harder for our skin to stay hydrated. Another reason that those omega fatty acids are so important, because they can really hold the water in our face. But hyaluronic acid can really help. So it's in a lot of your products, a lot of the anti-aging products. What I love is that we've got a great spot for that, and that's rose oil. And rose oil has other products that make it even more beneficial than hyaluronic acid. So whether the antimicrobial properties are what you need, the anti-inflammatory properties, or if you're somebody who's been really drying out your skin from treating acne, rose oil will not hurt. I'm going to have Elizabeth talk a little bit more about the use of oils in acne. Um, Rose oil can really help. It can help to hold in moisture. It won't comedogenic. It's not clog the pores. It's anti-inflammatory, and then it will help to kill some of those bacteria. But even in just an anti-aging pound, rose oil is a good one to help to rehydrate the skin and help hold on to moisture. A lot of people, they start to show the signs of aging first in their neck, and the neck can be really difficult to treat. So far I've talked about both frankincense and rose oil. Retinol is not going to be well tolerated on the skin of the neck for most people, but frankincense will be, and rose oil will be. See, some of these are in the ingredients in Immortel, which is another treatment we like for necks. But, Elizabeth, do you want to talk a little more about either rose oil or using oils when you have acne?
I think you kind of covered the rose oil, although just an additional use of rose oil is really good for capillaries. And so applying that, just areas of redness, rose oil can be really great for that, to kind of calm everything down. So rose oil also has an antibacterial component to it, so also can be really useful for acne, especially for people who aren't really interested in taking an aggressive approach to their acne. People who just want something soothing, something plumping, that also has an antibacterial component to it. I think rose is really, really great for that.
Oh, I know what I was going to ask. So are you afraid to tell people to use oils who've already got this excess oil production in their skin?
Yeah, so that was sort of one of those myths that has been busted up a little bit over the years. So the idea was that, when people were suffering from acne, especially teenagers, they said, starve the acne, right? It's from oil production. So you want to strip the oils, and that's when we started using things like Clearasil and Noxzema and all of these things that were just taking all natural oil of our skin. And it turns out that acne really needs a well-balanced environment to go away. So it actually needs oils. The skin needs, dry skin can cause acne just as much as oily skin. So it's really a matter of bringing balance and restoring pH to the skin. And a lot of the oils naturally restore pH to the skin. And then also a lot of the oils are in a carrier oil, which is basically coconut oil. And the coconut oil that we use to disperse the oil, because coconut oil is room temperature as a saturated fat, but they've actually removed the big chunks of fat. So now it's just sort of suspended in this liquid. So it's great. You can just put it, in the hand, add the oils, rub it, and then just apply it directly on your face. And so don't be afraid to nourish your skin. That's what your skin needs. Oils nourish your skin. And this goes back to what Jodee was saying about the essential fatty acids, how we were sort of tricked into taking all the fats out of our diet, and then, high sugar foods and all these processed. Yeah, that's not the answer. The answer is great sources of omegas, and then, topically using these oils as well.
And then sandalwood for hydrocortisone. I can't tell you, as a pediatrician for a long time, kids coming in with different skin conditions, our initial go-tos can often be hydrocortisone. And I think I'm more afraid of cortisol and hydrocortisone than those things ever have been, but certainly don't want to see people putting this on their face unless they absolutely have to. Steroid, and it's used to treat things like eczema and psoriasis, other rashes, but the side effects are really miserable. It says hyperpigment here. It can also hypopigment your skin, so it can change the color of your skin. It can thin the skin, which is the last thing that you want, because once your skin starts to thin, it can't hang on to water and it's a wrinkle. So we really try to avoid it on the face. Sometimes people will use it if they have cystic acne, or there's a number of reasons people are prescribing it. But a relief to me is that we've got an alternative pretty effective, and that's in sandalwood. Most of what I've looked at, people suggest Hawaiian sandalwood over Indian sandalwood, and I honestly don't know why. But sandalwood oil is both moisturizing, anti-inflammatory, so it can help in the same way as hydrocortisone can. It also can help to fight this hyperpigmentation. So hyperpigmentation just means like a darkening of the skin. And I actually think it can swing from dark to light. Like the pigment skin can get altered anytime you have inflammation in the dermis. So you may have seen someone, or you may have acne from when you were younger, and in those little acne spots, the acne itself is gone, but you've got little pigmented dots on your face, or lighter dots on your face. That's because there was inflammation down in the dermis, and it's the melanocytes have been kind of programmed in a damaged way. So if you have those issues, sandalwood can be great for to even out that skin tone. So just as you get the evening pH, you also can a restoration of function, the melanocytes, so that you're producing the pigment that your skin is made to produce. And then we've got great these instead of beta hydroxy acid, which I talked about, this is alpha hydroxy acid. Same idea though. We're just talking about this polite challenge in your skin, and this is a great like light chemical exfoliant for the skin. Unfortunately, when it's used too much, it can be kind of harsh on the skin. It really tingles when you put it on. In place of natural options to that, grapefruit oil is great. It's actually got a lot of age in it as well. So a yogurt grapefruit oil mask can be excellent. Grapefruit's circulation boosting, and then it also can help, just like lemon oil, like we spoke about, it help with some of that exfoliation that's needed for getting rid of some of the dead skin cells on the face. Got orange and chamomile for hydroquinone. So HQ, or hydroquinone, isn't something I heard a lot about until I got into the skin industry, and for good reason. This hydroquinone is out of prescription grade beauty products. It's in lower doses in the non-prescription grade. It's really effective at bleaching your skin, but with that highly effective bleaching, there are some systemic effects that be pretty damaging. We worry about the effect this has on your liver if you use it for longer than 4 months or so. Sometimes I'm kind of shocked, myself included in this group, at the lengths we'll go to for beauty fashion, and it will even go as far as to hurt our liver. But thank goodness, again, we've got a good alternative to this, and we've got a combo here of orange oil and chamomile oil. So if you're going for evenness, if you've got something like melasma, I'm going to let Elizabeth talk a little bit more about melasma so that we get that defined. But change pigmentation in your skin, there are definitely options for you that don't involve hydroquinone.
So at first, I think it's important, as Jodee was saying, to identify the source of the pigment. So just like she was saying, you can have acne, and some people don't even know if they have acne, or it's just, old or scarring or what have you. So you've got these, hyperpigmentations and hypopigmentation. So too much pigment and low pigment from, this injury to the skin, would not be, cystic acne from being young, or just any type of damage. And then we've got these brown spots, and nobody wants brown spots on their skin, but a lot of people don't know where they're coming from. So typical brown spots, which a lot of grandmothers and mom call liver spots, is kind of a way to talk about it. It's just basically sun damage, and if we go to the Zia and we look at the UV damage in the skin, all that stuff is below the surface, but it's just kind of waiting to come. And then as we get older, the melanocytes that are responsible for the color in your skin, they just sort of get confused, and they are sort of misdirected, and then they just come out of the skin. And then there's a more blotchy brown that women get specifically, and that's called melasma. Melasma is basically the mask of pregnancy. They call it pigmentation that happens just from hormones, essentially. So that can splotchy, and it's unsightly for some women. And honestly, pregnancy is not the only thing that can be hormonal birth control. So we're seeing younger girls 2 years and into their early 20s. And then it can just actually be hormones from getting that from the, the meat and the dairy. They're putting hormones in our food. So it's important to try to figure out, where your brown spots are coming from, and, can help you with that at Fresh Faces. Of course, if you want to come in, we don't treat black the same way as treat brown spots. But the nice thing about chamomile is that you can just treat all pigmentation with those two oils. Chamomile is great for lighting. It used to be, I don't know if you guys have ever heard of this, but they used to make chamomile tea and put it in your hair and the sun and light in it. So it's the same thing. You can use chamomile to lighten the spots on your face. That's pretty great.
Awesome. So this is such a wordy slide, but I love this graph because it helps to break down the use of the oils for whatever specific skin concern is. And I think both Elizabeth and I really encourage you to take, to feel kind of empowered from this and really think about what you're struggling with your skin and come up with blends that make the most sense for you. There are a few oils that we didn't talk about. We've included them on this slide. So geranium oil, which can really help to regulate oil production, decrease the appearance of wrinkles. Myrrh oil, which is one I encourage people to use it for anti-aging effects. It's anti-inflammatory. It can help with the appearance of fine lines. And then I'm going to let Elizabeth talk a little bit about neroli because I know that's one of her favorites. Oh, the sound.
Neroli is one of my favorite oils. So in the doTERRA world, we like to call the 3 flower oils, neroli, rose, and jasmine, the 3 queens. And they also, they're known for a lot of their emotional capacities, but also really, really, really good for skin, all of their different ways. But neroli oil is very hydrating. It's got antiseptic properties. It's really good for stretch marks and scars, and it can really reduce the appearance of pore size. So neroli is great.
Do you use much patchouli oil on the skin, Elizabeth?
So I love patchouli oil, and again, it's one of those oils that it helps reduce the appearance of fine wrinkles, and it also has antiseptic properties and antiviral properties and antibacterial properties. It definitely smells very strong, and so I think it's an oil I like to use, but I generally use it at home at night. Some people just love the smell of patchouli and they want to be bathed in it. Care provider, I have to be careful with patchouli. But we get in a lot of our eczema blends and some of our just, a lot of people come in with, just sort of these, it's basically called like atopic dermatitis. And it's just sort of dysregulation in this section. And so we use it a lot in that, especially in a carrier oil like coconut.
And then we are going to talk a little bit more about what rosacea is. So on that note, I did want to mention cypress and helichrysum. Cypress can really help repair capillary vein damage, but if you're somebody who, I'm kind of red in the cheeks right now, but I have a little rosacea that comes through my cheeks and on my nose, but you have broken capillaries, you have some redness in your face, maybe you have nodules, some of those can be the signs of a progressive skin condition, rosacea. So cypress oil can help a lot with that. It's a great astringent. And then helichrysum is also great with soothing that redness and that inflammation. Helichrysum also kills this Demodex mite, which they think may be partially responsible for some forms of rosacea as well. We did include the ingredients of Immortelle at the bottom, and I probably don't need to say anything else because we've covered all of those, and you can see, and this never surprises me, that doTERRA, their scientists are so brilliant. They know exactly what to put in an anti-aging serum. And so if all of this is overwhelming, my advice, get them well, and I like to keep in the refrigerator. I love the little roller ball at the end. I like to use that under my eyes. It's really soothing and calming. It's also not too irritating for that really sensitive skin under the eye. And I know people struggle with bags and with fine lines and wrinkles there, and to treat. It's an area that doesn't tolerate like retinols very well. So that's one of my favorite oils for that area. So here we have the essential oil regimens, and at the bottom you'll see we have a bunch of the doTERRA products. And as I just said prior to this, I really believe in how the scientists at doTERRA have put together these products. But I want to review a few of them. Um, some people have shared with me their favorites among these, and when I look at the research into each of these, it's pretty exciting. Let me start all the way over to the right with the reveal system. I brought this up earlier. I love this two-step system. This is right in line with that idea that you don't want to put your skin to sleep. You want to continue to challenge it. The first step of this has, lime, orange, and pumpkin enzyme. So lime and orange are delivering a great deal of antioxidants. They also have enough, like the salicylic acid, they also have enough of an acid base that they allow for a little bit of exfoliation, and that's a chemical exfoliation. And then that pumpkin enzyme is your final kind of exfoliation. There are jojoba beads in this. They're the safe kind of beads you can put in a soap, so these aren't going down the drain and harming the environment. But it's enough that you can get that mechanical exfoliation with it. Really nice. Then swinging all the way back over to the other side of the screen is that entire system. And I want to point out a few of the products in that. When we were at the talk at the Eco Trust the other night, people were talking about the brightening gel. And so I actually did some research into this, and I'm super excited about it. So you're going to find a ton of products on the market that tell you they have vitamin C in them. Now, vitamin C would be great to put on your face because that will lighten those dark spots. It will also stimulate collagen. But that's not true of any kind of vitamin C. As a matter of fact, the majority of the products on the market can't do those things. You might think they can, but they're not packaged the right way. Well, this particular, in the brightening gel, which is that small squatty one there on the right side of those products, this one actually has microencapsulated vitamin C that's at the right concentration where you will get penetration down into the dermis. You're going to see collagen stimulation. And remember what I had said earlier about collagen, that is where so much of the structure comes from. So we lose it over time. We need to do things to remodel it. And vitamin C is an awesome way, both in it internally, but then applying it topically, if it's microencapsulated, can really help with that. It's called a brightening serum because vitamin C is also a very safe way to lighten dark spots. And we all have some sun exposure from when we were kids that it causes inflammation in the dermis. It programs the melanocytes to misbehave. So we'll start to get more and more spots as we age. And this will help to keep your face clear and bright, which I think it's exciting that the science, again, it is completely supported. The other product that I want to point out in that group is the eye roller that you see there. So first off, I love the way this is packaged. It actually is a metal roller ball. This is one that I really like to keep in the fridge. I like for it to be cold. So much of what happens in the under eye, can be an accumulation of fluid. Remember that the fluid under your eye, the way that it gets released, people are always going like this. You actually want to push to the inside. So you can get an accumulation of fluid there. It's really, really thin skin through there as well. So it's easily damaged. So the products we put on that, they can be sensitizing. So you need something that's going to be not sensitizing to the skin there. So this anti-aging eye cream has frankincense, which I've talked a lot about using under the eye, ylang ylang, and blue tansy in it. Blue tansy is one of Dr. Josie's favorites. And the more we look at the effect on skin with blue tansy, the more amazing we see it is. There are things in this eye cream though that I love. And one of them, well, there are two factors. One of them allows for an instant tightening of that skin. So if you kept this in the fridge and you woke up in the morning and you had puffy eyes and you did that roll to the inside, you would see almost an immediate relief in that excess fluid, and it would flatten out. It would look great. But then it also has another component that over time is going to help improve the structure of that skin. So you're getting both the benefit of like instant improvement, and then the skin improves over time. So I really like that product a lot. And then I come to the middle, and my favorite product of all is smack down in the middle of this slide. And it's the hydrating serum, that Virage hydrating serum, bright green. On the previous slide, I talked about Mortel. This has Mortel in it. So everything that you need for anti-aging. But it's also got, it's suspended in jojoba oil, which is fantastic for hydrating, and awesome oil. It won't make you see, but is enough to help you retain the fluid in your skin. It also has squalene in it, and squalene is an awesome emollient. So, we've talked about challenging your skin and turning those skin cells over, and that can be a little bit drying. This is a great addition. It's awesome for the face and down through the neck. It will keep that skin moist without getting it greasy, which is really nice. The other thing that's in here that I'm really impressed with is the tocopherol, which is vitamin E. It's a natural form of vitamin E. It's well absorbed by your skin. It's an awesome antioxidant. It's also what absorbs UV rays. So UV is what comes from the sun and causes so much damage down in our skin. Now, I would not use this in place of sunscreen. You need both. However, putting this on your skin is another layer of protection from UV penetration. And the funny thing about living in Oregon, for those of you that are from the Northwest, we actually have some of the highest rates of skin cancer in the country. And it's because, when it's kind of cloudy out, we don't really think about our UV exposure. We are getting exposed to UV all the time, and we're not stimulated to put on sunscreen as much as we may be if we live someplace really sunny. So that product is extremely protective. And then it has your frankincense, your lavender, your myrrh, your sandalwood, all of those awesome anti-aging oils in it too, to be really protective. Finally, then, in the HD Clear products, two of our products of the month are in there, Manuka and Litsea. Both of those are fantastic for, they're antimicrobial in the Manuka, and then your Litsea is great as an astringent. So you're getting really great anti-acne properties in all of those as well. So Dr. Elizabeth and I put together a few recipes for you. I have to, preface this with, I really appreciate what's in the oils, the doTERRA products as they're prepackaged. This, though, you could put something like this together from that chart we had 2 slides back. Rosacea, we've talked a lot about. I've talked about the pathogenesis of this. This would be our recommendation. I know that our estheticians at the office will sometimes put this in a spray, so you can kind of spray it on and get a quick relief. And rosacea comes on when you get these kind of flushes of red. So we are encouraging 10 drops of lavender, 5 drops of cypress, 5 drops of geranium, 10 drops of manuka, and 5 drops of helichrysum. Again, that's going to kill that mite that they've associated with rosacea. It's also going to calm the skin, and cypress will really kind of cause a vasoconstriction of a lot of those blood vessels that are hyperdilated and causing all of that redness. Important to say, this doesn't cure rosacea. There is no cure for it. It's a progressive blood vessel disease, but this really can improve the appearance and the feeling of it in the immediate. And we have our essential oils for acne, a nice rollerball blend, lavender, which will decrease inflammation, soothe the skin, Mcelligott, which is fantastic specifically for the bacteria that are associated with acne. Juniper berry can help with that inflammation. It can help to clear out a lot of, we talk about, again, acne being caused by inflammation and clogged pores and excess sebum production, hormonal issues and irritation, and the bacteria. So you're going to get some improvement of that hormonal side of it from clary sage. And then finally, our anti-aging. Again, if you're simple like me, I go with Immortelle. If you're looking to put together, address your specific needs, I encourage you to use this at night because it has lemon oil in it, and that can be photosensitizing. Sorry. So lemon, frankincense, myrrh, lavender, and rose, and we like that in jojoba oil or argan oil. So finally, if you want to contact us, we can be reached at from our website, 880-5755. We're located down in the Pearl across from Ovation Coffee. Everyone that hears this talk is invited to come in for a free Visia analysis. That's the one with the 8 pictures of your skin. I think looking at where you're at with inflammation as it's coming out in your skin and seeing what that looks like after you've adopted a self-care regimen where you're addressing your health from the inside and the outside is kind of a fun way to have an objective view of how your self-care is improving the look of your skin. And I hope that you see some good improvements when you've put together a regimen that is specified to what you need. If you want more help in putting together something, the estheticians at our office are happy to help you as well. So that's everything we have. Both Elizabeth and I are so grateful to have had this opportunity to present and to be a part of this community. And we hope it's been helpful so you can start to take charge of your skin and apply these oils in a way that really improve your lifestyle from the inside and the out. Thank you.
Thank you, ladies, so much. Jodee, go ahead and go to the next slide. I absolutely love the doTERRA skincare line, and I've certainly seen massive improvement in my own skin health over the years from using it. And I have learned even more from this presentation. So again, thank you. So if you are new, we invite you to join us. And the very best way to do that is to open your own wholesale account. So you can go ahead and go to the next slide. We recommend that you talk to the person that invited you to this webinar, reach out to them, and they can help you navigate the very best way for you to get started. We have a lot of choices and great starter kits, and definitely we can customize whatever is needed for your personal needs. If you do not have a contact, and if you just came upon this webinar by chance, you can reach out to us at info@essentialwellness.life, and we will help get you started. So again, Dr. Jodee and Dr. Elizabeth, thank you so much for your time and your expertise. Super appreciate it. This webinar will be in our Essential Wellness Library, which is also a perk for joining our community. You get access to our library of our mini classes that we have every month. So thanks everybody, and have a great day.